Next is V6 hemorrhoids. A 32-year-old stock trader presented the history of bright red rectal bleeding after defecation associated with pain and pruritus. What is most likely diagnosis? Hemorrhoids. You perform a proctoscopy as shown. What do you see? What does the white arrow point at? The external hemorrhoid with the skin tag. The white arrow point toward the internal anal sphincter. And how do you differentiate perineal skin tag, external pile? Internal pile is very important for our question. So skin tag, its surface is not smooth and it is stratified keratinized squamous epithelium. The external pile, it lies below the dentate line and is smooth and not shiny, and it is covered by lined by non-keratinized stratified squamous epithelium. And internal pile, it lies above the dental line, it's shiny and is lined by the columnar epithelium. How do you do a conventional hemorrhoidectomy? So lithotomy position, infiltration of local anesthesia, piles are grasped and excised either with scissors, diathermy or energy device. Care should be taken to preserve the internal sphincter. The use of a proctoscope will help to identify the internal sphincter. The use of a proctoscope will help to identify the internal sphincter. The piles are tented radially to allow the safe dissection from the sphincter, and the adequate area of anoderm should be preserved to reduce the risks of anal stenosis. The vascular pedicles may be ligated by diathermy, sealed or with energy device, and the wound may be closed with a valve such as the left open. What is the nerve supply to the perineal skin? So above the dentate line, it's inferior hypogastric nerves, which are visceral and insensate, and peripheral fiber supply the smooth muscle, including the internal anal sphincter, and sympathetic fibers are vasomotor. And below the dentate line, inferior rectal nerves arising from the pudendal nerves, motor to the external sphincter and sensory to the lower anal region, and also the skin around the anus. Why is the pathology at the lower anal region painful? This is mediated by the inferior rectal nerves, which are both sensory to the perineal skin and motor to the external sphincter. For example, an anal fissure will result in a spasm of the external anal sphincter with intense pain. Thank you.